Hello aspirants, I am Indumati Karthikeyan from InKar IS Academy. Today we are going to see about the 29th November current affairs. The topic is from Delhi edition, that is AYUSHMAN BHARAT scheme. This topic comes under the GS3 welfare schemes for the vulnerable section of the population by the center and the states, and also for performance of these schemes. So why it is in the news? The Delhi Chief Minister Atishi on Thursday said our government in her principle ready to implementation of the center's flagship health insurance scheme, that is Ayushman Bharat Pradhan Mantri Jan Arogya scheme in this capital. So the Ayushman Bharat scheme was launched in 2018. It is a national health protection scheme by the government of India. It is a flagship program addressing the health issues in the primary and secondary and also the tertiary levels, recommended by the Indian National Policy 2017. It aims to overcome gaps in previous schemes like Rashtriya Swasthya Bima Yojana. Earlier in the scheme focused on the secondary and tertiary healthcare, neglecting the primary healthcare. To tackle this, Ayushman Bharat scheme was introduced, targeting health concerns of all the three levels to initiative under the program of the health and wellness centers and also Pradhan Mantri Jan Arogya Yojana. In this, we need to know about what is Ayushman Bharat program. That is Ayushman Bharat, the government of India flagship plan was launched and proposed the national health policy in 2017. Its object to universal health coverage, that is an effort to be created to meet the sustainable development goal and underlying the promise to leave no one behind that. So these scheme comprises two components, that is a health wellness center and also Pradhan Mantri Jan Arogya Yojana. That is a Pradhan Mantri Jan Arogya Yojana, the second component of the Ayushman Bharat, who seeks to provide over 10.74 crore poor and vulnerable families and health insurance coverage of 5 lakhs per family per year for secondary, tertiary, and hospitalization. Approximately, there are 50 crore beneficiaries are benefited, and also for the health and wellness center, that is a 1.5 lakh current sub centers will bring health and closer to the people's homes to the form of health and wellness centers. These centers will offer comprehensive healthcare, including treatment of non-communicable diseases and also mother and child welfare. So, why it is in the news? In the 2024, the Union government has approved that health coverage to all the senior citizens aged over 70 years and above, irrespective of the income, under the flagship scheme Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, to aims 4.5 crore peoples of families, that is a 6 crore senior citizen and 5 lakh rupees for free health insurance covered with the family basis. In the approval, the senior citizen of the age 70 years and above, irrespective of their socio-economic status, would be eligible to avail this scheme. And also, there is a senior citizenship is a new distinct card can be issued. So this will helps to get the plan accessible. And also, there is a senior citizen of age 70 years and above belonging to the family already covered the AB PMJ will get an additional top-up cover of 5 lakh per year for themselves. They do not have to share with the other members of family who are below the age of 70 years. So this is a very innovative idea that senior citizens have the 60 70 years already availing benefits. Public health insurance scheme such as central health insurance scheme, ex-service contributory health scheme, Ashman Central Armed Police Force scheme may also exist the ABPMJY. So it is clarified the senior citizen above 70 who are under private health insurance policies of employee state insurance scheme will also eligible for this scheme. So who are the beneficiary of this Ayushman scheme? That is, it has been implemented poorest to the most vulnerable 40% of population. The household included the base of socio-economic caste census 2011, deprivation and also occupational criteria in the rural and also in the urban areas. So the government has compiled a list of families to be covered based on the 2011 socio-economic census. Beneficiary in the rural areas includes households one room kacha house, those without any adult member, those headed by women who's belonging to the SCST, the homeless, the landless. The beneficiaries in cities include rack pickers, street sellers, domestic helpers, sanitation workers, and also the store workers. These are the eligible partners, and also there is a scheme replaced with the previous Rashtriya Swasthya Bima Yojana, which late started in 2008. As a result, it covered the PMJAY includes family who were covered under Rashtriya Swasthya Bima Yojana. So it is also covered by this scheme. So these are all the member for this beneficiary for the Ayushman Bharat. There is a entitlement under this act was, that is a aside from inpatient treatment expenditure, the system also covers various pre and post hospitalized charges. The program was planned to provide 1393 free procedure and accredited public and private healthcare facility across 24 specialties. So the patients are entitled to and also cashless care, and also they can give the private facilities under this initiative. So, how will the finance Ayushman Bharat be covered? First of all, we must know that the government fully fund PMJY, and the implementation expense in split between the center and also the state. The cost of the premium payment will be sent by the predetermined ratio between the central and the state governments. The scheme financing will be divided as follows: 60-40 for all the states' duties with their own legislation, 90-10 for the northeastern, and also three Himalayan states of Jammu and Kashmir, Himachal Pradesh, Uttarakhand, and also 100% duties without any legislature. What is the National Health Authority? First of all, we must know about this authority need for the Ayushman Bharat, that is financial protection from the catastrophic expenditure. According to the 2015 survey of NSSO, over a decade, hospitalization costs and essential illness had increased 300%, with the 80% of homes not covered by any health plan, and also any uh, individual bearer cost. So, to increase the insurance coverage, according to the Insurance Regulatory Development Authority of India, has 48 crore Indians, or less than one in every three Indians, have health insurance. So, reduce the poverty of India, this 6 million families sink into the poverty. So we need to hospitalize them, and also we need to give the hospitalization free manner. More bang on the buck of the center. The use of the insurance is reimburse healthcare cost, guarantees that the center gets more bang for its buck. That is, a household can be covered with a smaller budget outlays. So there is a inclusive growth. It protects ordinary people from financial damage. So we can potentially significantly improve the poor's economic situation as well as the quality of health. So but these are the important criteria, but we can make many challenges in this. That is, first of all, we must know that is state subject. Health is state topic. So under the Indian Constitution 7th schedule, aside from government institution like all India Institute of Medical Sciences and Sciences, the majority hospitals or medical centers state owned and controlled. As a result, the state bears responsibility for this. In such cases, countrywide health insurance program to supply healthcare facility at the state level, which dilutes the object of the scheme. And also there is a divert the fund for infrastructure. The state participation of plan require them to contribute fund for the insurance, and also there is a long term solution. But for this, we don't have any long term solution. That is a main criteria. And also shortage in the infrastructure like human resource, doctor quality have long been problem for many villages. Still lack of the access of the roads also. So roads, hospital, adequate employees. So these are the major concerns regarding this infrastructure line. And also there is a inadequate spending. Currently, the government spends only 1.15 percentage of the GDP on health, with ambitious to expand 2.5 percentage of the GDP. So it will in 2025. So it will definitely change, marks the changes. And also there is an unviable hospitals. So Ayushman Bharat has established inexpensive pricing in the many treatments. This may eventually decade the quality of services given, perhaps make hospitals unviable. In light of this, the state include Orissa, Delhi, Telangana, Kerala, Punjab have opted out of the scheme. And also there is a accountability in the private sector remains a problem. Ayushman Bharat does not currently serve the middle income segment. This is also one of the problem. What is a way forward for this? That is revise the procedural rates, incorporate large hospital into the program, and also fix the infrastructure flaws the grassroots level, ensure the seamlessly connective in regions such as Kashmir and also the Northeast, that is Seven Sisters, to improve the monitoring at every level to prevent the fraudulent transaction and also include advantages technology to keep check fake transaction and also beneficiary to take strict legal action against those who are failed to comply with the guidelines. Further, we may suggest that government hospitals should be excluded from the scheme because that treatment is currently provided at no cost. The government should directly support public hospital. This strategy is carried out through insurance companies to exchange at least 15% commissions, and also there is a insurance path and healthcare delivery should be avoided in India since the administrative cost and unholy nexus. The insurance corporation indicate the profit maximization rather than excellent service delivery. So need for an tax funded universal health coverage rather than for profit insurance model. So we need to tackle these kind of problem. The Aishman scheme will definitely won the success rate. Thank you so much.